Cancer centers are taking extra precautions to keep patients undergoing treatment protected. As coronavirus spreads, so is fear growing for those already in the fight of their life. Troy Washington is working for you to explain how experts are dealing with it all.
Getting a cancer diagnosis is scary, even scarier, the thought of being at higher risk for coronavirus.
People around the world are concerned about the coronavirus right now. So cancer patients are already going through a time of anxiety and stress about their health, and this just makes it worse.
Sarah Gretline is the medical director for the Joe and Shelley Schwartz Cancer Center and the Simon Cancer Center, where people come to overcome cancer. Now, while jumping over that hurdle, patients are potentially staring right at another.
Patients undergoing chemotherapy and immunotherapy are at a greater risk for all of the viral illnesses that are out there.
As more cases appear, experts are trying to understand the virus.
We are all learning about this particular variant of coronavirus. There are many of them, but this particular coronavirus, all the information is new.
Here's what experts do know. Cancer patients and survivors with compromised immune systems need to take precautions. They tell WRTV these precautions aren't much different from the usual advice given to someone battling cancer and undergoing treatment. When it comes to limiting exposure to potentially contracting coronavirus, the same approach applies.
I advise them to avoid crowds that aren't necessary. So, for example, going to the supermarket, you don't go during peak hours, you go during the time when it's mostly empty. We can see that even for healthy people, a lot of large public gatherings are being canceled, and so patients at a higher risk of a severe illness, it certainly makes sense to reduce their exposure to travel.
The center says they were already restricting visitors because of the flu, but now there's a virtual hub that helps too. IU Health's virtual hub helps screen people for the virus in hopes of catching it early and keeping people from passing the virus to anyone else. Gretline says it takes working together to keep everyone safe.
That allows us both to serve patients in the community and to protect patients already at our facilities.
Working for you in Carmel, Troy Washington, WRTV.
And experts advise and say to avoid touching your eyes, nose, or mouth with unwashed hands, washing your hands often for at least 20 seconds with soap and water, or using an antiseptic hand gel is recommended, and it is best to avoid crowded areas and sick people.